Hi everybody, it's Dr. Heather Denniston with Well Fit and Fed, and I am going to teach you some foam roller today. Now, foam roller is an excellent tool to release muscle trigger points, increase circulation, and hydrate. And your muscles are going to love it, okay? It can be a little uncomfortable to do parts of it, but it shouldn't be painful. So when you're doing your foam roller, please make sure you stay out of the pain zone. The uncomfortable or right on the edge, that's okay, but we don't want to injure ourselves. Now, a couple of watch outs. You do not want to roll out your neck, okay? That's not safe. I'll show you something you can do with your neck. You do not want to roll through the spine. We're going to just pin and stay instead of rolling. Other areas we're going to do lots of rolling. And you want to work each area for at least 30 seconds. And so what I recommend is each day just pick a part of your body and do a little bit of rolling. It's so good for you. Now, we're going to start demonstrating. I'm going to be talking as we go, and I'm not going to roll out as long as you should when you're at home, but I want to do that so that you don't have to sit here for a half hour watching me roll out, okay? So I'm going to show you each of the locations, how to do it correctly, and we'll move on to the next one so it's nice and speedy. Other watch outs are if you have an injury, it doesn't necessarily mean it's safe to roll it out. It doesn't mean you can't, but you need to talk to your provider and find out if it's okay for you to roll. If you are working an area, just because it's tender and achy doesn't mean you want to dig in there harder and roll it, okay? So just be aware of your body and listen to it, and it will tell you if this feels like a good uncomfortable or a painful, and we want to stay away from painful. Okay, let's get started, and I'm sure I'm going to remember things as we go. So we're going to start with the calves, okay? We're going to go through the body in a systematic way. And there are lots of ways you can do the calves. If you're new and you don't have a lot of strength in your upper body, you can just lift up a little bit, not off the floor, a little bit, and just roll through that way, all right? And you want to get to the edge of the joint, not roll over the joint. So you're never gonna roll out calf all the way up to hamstring. You wanna protect the knee, protect the ankle, protect the joints in general. So for the most part, you are going to roll out above and below the joint, not over the joint. Back to the calf. Let me bring you a little closer here. Now, if you have pretty tight calves and you want to get a little deeper, you can lift up and roll that way, and you can also cross your leg over, put some pressure on the top of that leg, and that is definitely the most noticeable when you roll that way. Now from here, you can also turn a little to the side and get, and I put my leg over for pressure, the peroneals. The peroneals are the little muscles on either side of your leg that get very, very tight because they're always trying to stabilize our ankle. And if you've had ankle injuries, often it's going to be very tight as well. So you'll do both calves, both peroneals, about 30 seconds on each section. You can do more, but try to keep it at least 30 seconds. Now hamstrings, easy. Just above the knee, you're gonna lift up and you're gonna roll, okay? We're gonna go right almost up to the crease of the butt and rolling back and forth. Now with hamstrings, a lot of the time, it's not gonna feel as tender as other areas, but don't be fooled. Anytime you do foam roller and you're compressing muscle, I want you to think of a nasty, dirty sponge, okay? That sponge squeezes and all that gunk comes out of there, and then as it releases, it imbibes and brings in incredible fluid, circulation, so much goodness. So even though it's not super tender up here a lot of the time, you can just still roll through there and get lots of great effect. Now, you have a band right here called your IT band. It's probably one of the tightest parts in your body, if you're anything like me. And so turning on your side, and then what I do is I bring my knee either up or here, and we roll the IT band. I am steering clear of the knee and the hip, and just really quite enjoying the very exquisite nature of what an IT band feels like to roll out. So you would do that on the other side as well. So we've done calf, peroneals or lateral muscles here, hamstring, IT band, now we're on to the glutes. So we lift up, all right? Now, you don't want to roll the flat part of your sacrum. Okay? Don't put so much pressure on your tailbone and on your sacral bone. You want to be in the fleshy part of your tush. So you're going to lean a little to the side and you roll up and down just like this, okay? And when you find a tender spot, you can kind of hang there and let that pressure lean in, and you can kind of wiggle a little bit. That's okay too. So there's some variety that you can apply with the foam roller. So we would then flip to the other side and do the glute on that side. Now, really important, in my opinion, my 25 years of chiropractic practice opinion, you do not do the low back, okay? It's too risky. It's hard to keep it stable and not subject it to being irritated, moving it out of alignment, creating inflammation. So we don't start down low. Where you're gonna start is where your low back turns into your mid back, is the place you start on your back, okay? And we don't do this, okay? We don't roll out the spine, again, my opinion, because it's safer to pin and stay. And what do I mean by that? I mean you pick a spot and then you stretch over and hold. Now, some of you may need to hold your neck, and that is okay. And when you come back up, what I recommend is that you tighten your tummy, and then, so I'm back here, tighten my core, and bring myself up like a sit-up, and then I get to the next spot, and I extend back over. All of this should feel very safe and comfortable. Pops and cracks. If you are getting lots of pops and cracks, it may mean that you're overdoing it. If you are trying to get lots of pops and cracks, you're headed for danger, because you don't know if those pops or cracks are shifting you out of a good alignment, in a good alignment, if it's creating inflammation, if it's causing problems. It's just not a good idea. If while you're stretching you get a couple of shifts or a little snap here or there, that's fine, of course. But if you're going after the foam roller to pop your back or create movement in there, not safe, okay? So that's the mid back. Now you can go almost up to the top. Sometimes the shoulder blades get in the way, but go as high as you can, because now what we're gonna do is this is one of my favorite parts, stretching out the rib cage. Remember that you have two floating ribs. The last of your ribs, 11 and 12, actually don't wrap around and attach up here. They just kind of hang out here. So if I put a foam roller on that, oh, that's gonna be uncomfortable and unsafe. So you wanna be up just a little bit, and in the kind of main part of your thorax or your chest. And what you're gonna do is just get comfortable, palm flat on the floor, and stretch over. And I will sometimes extend my leg back so that I get even more of a stretch in the hip flexor as well. It's kind of a double whammy. That rib stretch is golden. It feels so good because we often don't stretch our bodies that way, and we sit hunched forward all day, and so getting some extension and opening up that chest cavity feels delicious. Now, what doesn't feel delicious is the next one, but you're gonna have to do it anyway. As we sit all day and we're typing on a computer, our shoulders roll forward and we get all tight in our rotator cuff, and we can set ourselves up for shoulder injuries. So doing the latissimus, the rotator cuff, and the tricep, which we do all at once, is super smart, but very uncomfortable, okay? Now I say you should never be in pain on the roller. You can be exquisitely uncomfortable, but not in pain, okay? If you're in pain, you're either pushing too hard, trying to make it go too fast, or you're doing an area that is just saying, no, please don't, okay? So out here, start on the tricep, get your foot here ready to go, and we roll up and down top of the tricep to the latissimus, okay? And then you can take a little lower spot. Let me bring this down a little bit. You can take a little lower spot and latissimus, very sore. You can address that as well. We talked about neck, and neck you do not roll out. Please don't ever roll your neck. It's not safe. There are other things you can do, and what you can do is just take a little breather. This accentuates the healthy curve in your neck, and you do not rock back and forth like this. You just look up at the ceiling and you just let things traction and relax. This is a nice way to finish your foam roller practice. So that's an option. Now, we have just 2 more things to do. Quads, well, it's kind of 3, but we'll call it 2. Quads I love because they get so tight and so congested, and so this is a really good option. So we start just above the knee, and then we roll back and forth. Now, if you don't have the upper arm strength to do this, you can do one at a time. You can do one at a time anytime. So get one leg on, one leg off, and you just roll back and forth like this. Now I can use my other leg for stability as well. Now another little trick for quads. Quads have 3 parts, inside, middle, and outside. We just did the middle. So now you can tag team the inside and outside by getting a little Cirque du Soleil, and you turn like this, inside and outside. So I'm outside on the left, inside on the right, and then outside and inside, outside on the right, inside on the left. That's an option to get all parts of the quadricep. Now, a really important part is the inner thigh, right? We know it's tender, it gets tight, and so what you're gonna do is you're gonna twist your foam roller, you're gonna get your inner thigh on it, and you're just gonna roll. And for most people, it's very tender just as you get toward the knee. Remember, we don't roll over the knee, just above it, but this spot right here where all these muscles attach, often very in need of foam rollering. Finally, we have one of my favorites, and again, you can modify this one, but we're gonna take peroneals, okay, or not peroneals, your shin muscles. Any of you had shin splints? This is a dream for shin splints. So you get on the foam roller, you point your toes together, and you roll in and out, just like that. Now, if you don't have enough upper body strength or balance, easy. Just put one leg on and roll in and out like that, okay? So that is foam rollering basics. There are certainly lots of other things you can do on the foam roller, but that gives you a good body-wide workout. And so if you have any questions, check out Well Fit and Fed. Message me on the Facebook page on Well Fit and Fed or on this YouTube channel. I would be happy to answer anything at all. I hope you've enjoyed this. Please share with others, and we'll chat soon. Goodbye.